Welcome to Ulosca channel. Access all nursing practice questions. Introduction to Radiography and Patient Care practice questions with answers.
Question 1. What is the primary goal of the Ulosca principle in radiography? A. To reduce image resolution. B. To minimize patient radiation exposure. C. To decrease equipment costs. D. To shorten examination time. Which one is the correct answer? The correct answer is B. To minimize patient radiation exposure. Explanation. The Ulosca principle focuses on reducing unnecessary radiation exposure to patients by applying safety practices without compromising diagnostic quality. Question 2. Which body position describes a patient lying on their back? A. Prone. B. Supine. C. Lateral. D. Trendelenburg. Which one is the correct answer? The correct answer is B. Supine. Explanation. The supine position involves the patient lying flat on their back with the face upward, commonly used in many radiologic examinations to access anterior anatomy. Question 3. Which organization is primarily responsible for accrediting radiologic technologist education programs? A. FDA. B. ASRT. C. GERCERT. D. OSHA. Which one is the correct answer? The correct answer is C. GERCERT. Explanation. GERCERT ensures that educational programs meet quality standards and prepares competent radiologic technologists. Question 4. Which term describes the practice of ensuring patients understand the risks and benefits before a procedure? A. Confidentiality. B. Informed consent. C. Documentation. D. Triage. Which one is the correct answer? The correct answer is B. Informed consent. Explanation. Informed consent is a legal and ethical requirement that involves explaining a procedure, its risks, and benefits to a patient, allowing them to make an informed decision about their care. Question 5. What is the most effective method of preventing the spread of infection in a healthcare setting? A. Wearing gloves. B. Using antiseptics. C. Hand hygiene. D. Using masks. Which one is the correct answer? The correct answer is C. Hand hygiene. Explanation. Proper hand hygiene, including hand washing or using hand sanitizer, is considered the most important measure to prevent healthcare-associated infections by reducing the transmission of pathogens. Question 6. Which of the following is a late effect of radiation exposure? A. Hair loss. B. Erythema. C. Genetic mutations. D. Skin burns. Which one is the correct answer? The correct answer is C. Genetic mutations. Explanation. Late effects like genetic mutations result from long-term or chronic radiation exposure, possibly affecting DNA and leading to hereditary conditions or cancers years after exposure. Question 7. Which radiographic projection involves the patient lying down with the X-ray beam directed horizontally? A. Upright AP. B. Lateral decubitus. C. Oblique. D. Supine PA. Which one is the correct answer? The correct answer is B. Lateral decubitus. Explanation. Lateral decubitus positioning is used to visualize air fluid levels or free air within body cavities by positioning the patient on their side with a horizontal X-ray beam. Question 8. Which of the following describes the ethical principle of doing no harm? A. Justice. B. Beneficence. C. Autonomy. D. Non-maleficence. Which one is the correct answer? The correct answer is D. Non-maleficence. Explanation. Non-maleficence is the ethical obligation for healthcare providers to avoid causing harm to patients, ensuring all interventions prioritize patient safety. Question 9. When transferring a patient from a stretcher to the radiographic table, what should be done first? A. Move the stretcher quickly. B. Explain the procedure to the patient. C. Lower the table below the stretcher level. D. Avoid using transfer devices. Which one is the correct answer? The correct answer is B. Explain the procedure to the patient. Explanation. Explaining the procedure builds patient trust, reduces anxiety, and ensures cooperation, all of which contribute to a safer and smoother transfer process. Question 10. What is the primary purpose of using immobilization devices during radiographic procedures? A. To improve patient comfort. B. To increase exposure time. C. To reduce motion artifacts. D. To decrease operator effort. Which one is the correct answer? The correct answer is C. To reduce motion artifacts. Explanation. Immobilization devices prevent involuntary or voluntary patient movement, improving image clarity by eliminating motion blur and reducing the need for repeat X-rays, which minimizes radiation exposure.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.